Hi, I am Dr. Nagarjuna Maturu, a consultant in pulmonary medicine at Yashoda Hospitals, High Tech City, Hyderabad. What happens when you don't treat an ILD? The answer is that it progresses. So, when an ILD progresses, what happens is the person's symptoms start becoming more severe. The cough becomes very troublesome and it starts disturbing his sleep and activities. Similarly, the patient's breathlessness starts becoming worse. He would be initially in the beginning of disease, they will be able to walk for longer distances, but as the disease progresses, they will be able to walk only for short distances, and eventually they will become breathless even at rest. So that is how the symptoms increase. Then if you do not stop ILD, then it will eventually lead to respiratory failure, which means the lungs will stop working well. So then what happens is the oxygen levels fall down. So that is very, very dangerous, because if oxygen levels start falling down, then the whole human body will again start getting affected. This is a very dreaded complication called as respiratory failure. It indicates that it is a very, very severe ILD. Second thing which can happen is what you call as right heart failure. You have to understand that the heart and lungs are closely interlinked. So whenever there is a disease which is affecting the lungs severely, there is something called as a pulmonary artery. The pressure in the artery will increase. Just like blood pressure, we medically call it as the pressure on the heart. So this pulmonary hypertension means the pressure on the heart increases, and that leads to right heart failure. So the heart will not be able to pump blood properly, and that leads to swelling of the feet, swelling of the abdomen, and that is also a very, very bad thing to happen. So in the end stage of ILD, you will develop lungs failure, respiratory failure, and right heart failure. If these develop, then it indicates that it is a very, very bad disease. You can follow our page for learning more about pulmonology and for further information.